My name is Keith Cha-Cheng-Ho. Today I will present my mini project for the topic Physiological Optic 2 and the title Optical Correction in Practice. My topic is focusing on presbyopia. So let's get started. Let's start with introduction of presbyopia. Our vision depends on accurate focusing of light onto our retina by the cornea and crystalline lens. However, aging may reduce the eye focusing ability and cause blur vision. One common age-related refractive condition is presbyopia. This project discusses about presbyopia, its correction method, optical principle, and the use of digital and AI supported tools in our modern optometry field. This is the task 1, refractive condition correction methods. So for our presbyopia is an age-related reduction in accommodation where the eye gradually loses the ability to focus on near object. It usually begins after the age of 40 and it's considered a normal physiological aging process. It is natural. The main cause is loss of elasticity of the crystalline lenses. For normal accommodation versus presbyopia, in our normal eye, the ciliary muscle contract the lens become thicker to increase the optical power for the near vision for reading. In presbyopia, the lens becomes less flexible and cannot increase power effectively. As the result, near images focus behind the retina and near vision become blur vision. Next, the causes of presbyopia. The major causes of presbyopia include loss of lens elasticity, reduced ciliary muscle efficiency, decreased accommodation amplitude, and age-related changes in the lens capsule and zonules fibers. These changes reduce the eye's ability to focus on near object. Here let me look into symptom and visual effects. Common symptom of presbyopia includes blur near vision, headaches, eye strain, and difficulty of reading small print. Many patients also need to hold reading material like far away. So this symptom may reduce the productivity and cause visual fatigue during near work. And we can look at the table. So usually like visual fatigue, we will have tired, like poor vision, difficulty, and reduce the productivity, and especially for accommodation difficulty. Next, this one is for our spectacles correction. This is one of the methods. Like presbyopia can be corrected using spectacles such as reading glasses, bifocal lens, and progressive like multifocal additional lenses. Spectacles are affordable, easy to use, and non-invasive. However, they may cause magnification effect and require adaptation period, usually 3 weeks to 4 weeks. Next, like contact lens correction. This is also one of the correction method. Like contact lens correction includes like multifocal contact lens and monovision contact lenses. They provide a wider field of view and better cosmetic appearance. They don't need to wear spectacles. However, contact lens may cause dry eyes, discomfort, and require proper hygiene to prevent infection. The next method for the refractive surgery. So this one is a bit more expensive. So refractive surgery option include like LASIK monovision, like presbyopia, LASIK, and refractive lens exchange. These methods reduce dependence on the spectacles, and contact lens provide long-term correction. However, they are more expensive, may involve the surgical risk such as like glare and halo effects. So usually we can wear contact lens and spectacles instead of doing this refractive surgery. Next, we have this comparison table. This table we compare about the spectacles, contact lenses, and the refractive surgery. Spectacles are the fastest, the more safest, more safe, and more affordable option. Contact lens provide a wider field of view, while refractive surgery offer a more permanent correction, but involve higher cost and more surgical risk on the surgery. Here, in the other hand, clinical case, we can look at this clinical case. This clinical example involved a 46-year-old teacher who complained of their near blur vision and difficulty of reading smartphone and messages. So examination shows the reduced accommodation amplitude. The patient was prescribed plus 1.5 diopter reading glasses, which improved the near vision and reduced the eye strain. So this one patient, they can use reading glasses, or we can recommend use contact lens or progressive multifocal spectacle lens. Next, this is the second task. So for this task 2, we discuss about the important optical principle include the magnification, the lens effectivity, vertex distance effect, and clinical calculation. These principles are important to ensure accuracy optical correction. So let's get started. So first, there are magnification. So for this, magnification refer to changes the retinal image size caused by corrective lenses. Like plus lenses magnify image and make the object appear more larger, like the reading glasses or the magnifying glasses. So while minus lens, they reduce the image size, like minus power lens, they will look the image more smaller. So excessive magnification, too much excessive of the magnification effect may affect binocular vision and adaptation period. Then next, we look at this lens effectivity. So lens effectivity refer to changes in effective lens power when the lens position changes. So the formula shown here is used to calculate the effective power. More accurate, the positioning is more important in the clinical practice, especially for high prescription spectacles. Vertex distance effect is also very important. For this, vertex distance is the distance between the spectacle lens and the cornea, the gap of distance between the lens and our cornea. So moving a plus lens more far away from the eye to increase the effective power, while moving the minus myopia power lens more far away decrease the effective power. This effect is especially important in prescription above plus or minus 4 diopter above. When the power is minus 4 or plus 4 above, this effect will become more effective. Here, this is a calculation example. In this example, the patient with a plus 8 diopter lens is moved 12 millimeters away from the eye. Using the formula, the effective power becomes plus 8.85 diopter, become much more higher power than the patient needs. This demonstrates that increase the back vertex distance is increase the effective power of the plus lens. In clinical relevance, we have to know, in clinical practices, incorrect vertex distance may cause blur vision and poor adaptation to the patient. High prescription patients require accurate frame fitting. They need to have more accurate frame fitting because they have high power, and contact lens eliminate vertex distance problems because the contact lens is sit directly on our cornea. Here, this is our task number 3. For task 3, we focus on the digital and AI supported tools used in the modern optometry. These technologies improve the measurement accuracy, reduce human error, and improve the patient care. It's more efficiency. For my selected digital tools, I will choose autorefractor. Autorefractor is the computerized instrument that automatically measures the refractive error. It measures the sphere power, the cylinder power, the axis, and the pupil distance. The device uses infrared light and display refractive results digitally, and some is semi-auto, and mine chose is automatically. This is the sample for the digital data print out from the autorefractor. This slide shows the sample autorefractor data that the patient demonstrates mild hyperopia and reduced accommodation amplitude of 1.5 diopters. These findings are consistent by presbyopia. As we know, the AI-supported analysis is also very important. Like now we have AI technology. AI-assisted the system help better analysis refractive data more quickly and improve the prescription more accurately. So they also reduce the human error, detect abnormal pattern, and store patient records digitally. This improves the consistency, patient management. This is a lot of helpful to optometry field. For our cornea topography and the technology, the cornea topography maps the shapes and curvature of the cornea. We can see in the picture, which is show the curvature of our cornea, and that is a map. So it is useful for detecting the cornea irregularities, fitting the contact lens more accurate and more comfortability, and planning refractive surgery. If using refractive surgery patient, they must have this mind map, have this cornea map. So this modern technology improves correction, accuracy, and clinical efficiency. For the additional clinical discussion, that proper optical correction is important because inaccuracy prescription may cause blur vision, headaches, eye strain, and poor quality of life. Near working distance also affect the accommodative demand. Closer object require greater accommodation, which become more difficult in the presbyopia. Task 4 is my video presentation. All the above are my presentation content. This presentation I summarize presbyopia, the instruction, the introduction, the correction methods, the optical principles, digital tools, and clinical interpretation. For conclusion, presbyopia is a common age-related refractive condition that affects accommodation and near vision. Correction method includes like spectacles, contact lens, and refractive surgery. Optical principle and digital technologies are important for improving the correction and the accuracy for the patient care. So very important, and we know presbyopia is very common to us when we reach our age, 40 or 40 plus, then presbyopia, we will have it. So please take care everyone. These are the references used in the project, so included the clinical refraction and the physiological optic sources. Thanks for watching. This is my presentation. My name is Kim Chia Cheng Ho. See you next time.